Welcome back to Periop Talk. I'm Nakeisha Tolliver, the 2024 president of AORN, and I'm excited to bring you another conversation with Linda Groah, AORN's longest serving CEO. On our last episode, we had an opportunity to talk to Linda about the last 20 years of AORN's history. Today, we're going to talk a little bit more about the future of perioperative nursing and see where she thinks that's going in the next 3 to 5 years. So I hope you enjoy this episode.
Welcome to Periop Talk, making surgery safer one podcast at a time, with brief, practical information for you to take back to the OR.
How do you see the role of perioperative nurses evolving in the context of emerging healthcare trends like telehealth, AI, and robotics?
Most important, Nakeisha, I think, is that we need to become comfortable with telehealth, with the equipment, with the software, and learn to use it as a communication tool to really participate in, for instance, remote surgical observations, in surgery consultations. It's a great advancement forward for patient care. We also, as part of that, all the technology is data management. We will have access, and do now have access to, a lot of data that we need to learn how to use. There's something called data overload, and I think we all suffer from that. I mean, what do I do with all this data? How do I use it? So basic understanding is so important when it comes to technology. And especially another area is inpatient monitoring. How can we use technology to improve patient monitoring? And also learn to use it for clinical decision support. If all the factors are there that this patient is at risk for decubiti, then we should take the action that's associated with that. So that clinical decision support models become very important to perioperative nurses. And as part of that is the ability to use critical thinking. Critical thinking, I really believe, is one of the most important attributes perioperative nurses have. We think on our feet, we act on our feet. And in all those cases, it has to be to improve the patient care, to control the situation, and to really have an outcome and look at it from the outcomes perspective. I think one of the most important there that I could not forget is continuous learning. That's part of a perioperative nurse's role. And AI and all the technology, rather than being afraid of it, we have to embrace it, and we have to learn how to use it. Lifelong learning is part of our role, and most perioperative nurses are very tech savvy. They're probably the boys and girls when they were growing up that learned to use a hammer very quickly as a child. And it carries over into all the technology we have to manage in the operating rooms.
What are your thoughts on the future of perioperative nursing education and training?
Well, I think most of all, we have to have greater emphasis on technology and how important it is. And that has to come from the schools of nursing as they structure their curriculum. Evidence-based practice, I think that is another area that we need to emphasize. And that's Periop 101 for the novice nurses in Periop, has been built into all of those modules, is evidence-based. Interdisciplinary collaboration, this is an area that is essential as we move forward. Equal voice for the care of the patient will result in a patient-centered model, and patients will know the difference. And I think the other thing is continued emphasis on culturally sensitive care, and how important that is to the wellness as well as the recovery process.
How can AORN continue to address the nursing shortage and attract more individuals into the perioperative specialty?
Getting interest in grade school in nursing is a great way to get that started. And local AORN chapters can make a difference there. They can volunteer to go into the schools, grade schools, primaries, junior highs, and high school, and participate in career days, demonstrate what it is that perioperative nurses do. I know that particularly the young children love it when you come in with masks and gowns and a few instruments that are used, and even sometimes set up a back table that they can actually see. And it really does start that interest. So it's really important to follow that up then with potentially scholarships and grants for people to go into nursing and to identify periop as a specialty that they're interested in. In the facilities, in the hospitals, providing a really smooth onboarding or orientation process is very important. We know that a lot of the nurses need to have support as they enter the clinical setting. They don't get that much experience in the schools of nursing. They're really focused on learning the basics, and the specialties have been left behind as a result of that. The specialties used to be part of the curriculum, but they no longer are. We were very fortunate at AORN that we set up a partnership with Chamberlain University, and that program has resulted in over 1,000 young perioperative nurses having the opportunity to participate and take the 17 modules that are introduction into periop, and then making the decision on whether or not that specialty is for them. And it's been very successful. Over 80% of the students that have taken that have wanted to go into perioperative nursing. So getting them started early on is really important. We need to continue to focus on the technology. This is exciting for many of the young people. This is where they see the future. And surgery is going to continue to evolve, using more information on the DNA and how does that influence surgical procedures and what we're able to try. And I think the other thing that is so important to getting people interested in periop, this is one of the few times in the patient's experience when they are totally dependent on the nursing care. They're anesthetized during surgery most frequently, and they really depend on a perioperative nurse to care for them and to be that patient, their eyes, their ears, and offer the care that they would do for themselves if they could do that. So patient advocacy and how important that is a strong reason for some nurses to choose periop.
What regulatory issues are on the horizon, and what concerns haven't quite surfaced yet that we need to be prepared for, that could come up in the next several years to come?
Well, I think in technology, we need to be very guarded, and we need to be involved in how the technology is developed so that we're at the ground floor of that technology, always keeping in mind what's the impact on this technology to patient care and patient outcomes. So working with the vendors, that is important. Also, how that would evolve into legislation, which is making sure that there's adequate guidelines when something new is introduced with technology. taking it into the simulation centers first, for instance, before the team actually uses uses the technology on a patient. But I think that's one of the biggest areas is the technology. The other area that I think we should need to be alert of is the protection of our practice. The erosion of the state nurse practice acts within each state it has to be of concern, and we have to stay alert to that. We want nurses to practice to the full extent of their practice, of their license, and we want to protect that. And so that's constantly being on guard to see to make sure that that practice is protected. Another area is ergonomics. Working in the operating room is not easy. It can be very taxing on the body. We stand for long periods of time. We lift and participate in lifting patients, moving equipment, and all of that comes down to the ergonomics that needs to continue to be on our radar in terms of what OSHA and NIOSHA are looking at for employee safety. So those are areas. I think also workload and safe practices for staffing are. I know right now ANA is looking at that, and we are looking and supporting a lot of the work that they're doing. Although we have one circulator for every patient, we still are participating in other areas and supporting the nurse-patient ratios in those areas.
What are 3 predictions for the future of perioperative nursing?
3. Well, first of all, I think we've already mentioned that we need to look at increased integration of AI and robotics, including the use of data analytics. And that means we've got to do some continuous learning there, because those of us that have been out of school for a long time, if we haven't kept up with everything, are going to have to run fast to catch up. The expanded role of the advanced practice nurses in surgical decision-making. I believe that we will see, most likely in the near future, I think it's already starting there somewhat, is the surgical nurse, the perioperative nurse, being a partner in practice with the surgeon. So the two of them together are basically managing and providing care to the patient. The advanced practice nurse, as a nurse, for instance, a nurse practitioner, could be involved in and do the pre-op assessment. The surgeon decides what surgery has to be done. The nurse practitioner may function as the RNFA during surgery and be the communication with the family post-surgery, and the surgeon making rounds to discharge the patient. But I think that the advanced practice nurse could even expand her role into that. So a true partner with the surgeon and a perioperative advanced practice nurse. I think the other area that is really important in the future is emphasis on perioperative nurses' well-being and what that means for retention. We've got to do something about the on-call practices. They are archaic. We should not expect somebody to work 8 hours, go home for 2 or 3, get called in, work all night, and have to be there the next day to start another case. That is not safe practice. Again, we have evidence-based research that tells us that nurses should not be practicing over 8 to 10 hours in one shift. And we have not, in many instances, taken that evidence-based practice or that evidence-based information and changed our guidelines for staffing. But I really think that the emphasis on we won't get nurses to come into Periop if the working conditions are not acceptable to them and achievable.
So, what advice would you give to a young or novice perioperative nurse that's just starting their careers today?
First, nursing is a profession, not a job. Challenge yourself to make a difference in patient care and the specialty. Embrace continuous learning, use effective communication, and stay focused on patient-centered care. Keep an open mind, seek mentorship, always focus on patient safety, and stay involved in your profession.
Thank you so much, Linda, for joining me today to talk about the future of perioperative nursing. It just goes to show how much of an amazing future we have to come for our profession.
Well, thanks for the invitation, Nakeisha, and we have a great future in front of us. We have to be open and ready to accept it. Thanks again for the opportunity.
As always, thank you for joining Periop Talk. It has been an honor to have Linda Groah share her wisdom and experience with us. We're grateful for her invaluable contributions to perioperative nursing. Her legacy will undoubtedly shape the future of our profession for many, many years to come. I'll ask you, what predictions resonated with you the most? Where do you see our profession in the next 3 to 5 years? And as always, tell us your comments below. Thank you so much for joining us today, and we hope to see you on the next episode of Periop Talk.
Enjoyed the episode? Please like, comment, and subscribe. For additional Periop content, look for us on Instagram at AORN Pics and on Facebook and LinkedIn at AORN. You can also find us at aorn.org. Thanks for listening.